Yeah, I feel like it's really important to use an NSAID like OMIDRIA in cataract surgery because that's where inflammation starts. I've been asked, like, when is a good time to use OMIDRIA? I think, it's a 4 ml bottle that goes into your solution, or 500 ml solution, and you can run that through your phaco machine and then get a little bit of that sample out early. And then I have my nurses draw that up. So right after the paracentesis is when I put OMIDRIA in the eye. So you want to go in the eye with that solution to kind of suppress everything. Otherwise, you would be waiting until you're actually in the eye with a phaco tip. And that would be after a main wound. That would be after viscoelastic was put in the eye. That would be after a capsulorhexis was done and maybe hydrodissection. So there's a lot of steps there that would stir up inflammation before you ever use your OMIDRIA. So we want to try to suppress that inflammation at the time of surgery. OMIDRIA also has that benefit, though, intracamerally, to keep that pupil nice and dilated, specifically patients that have intraoperative floppy iris syndrome, where they may even have a normal sized pupil at the beginning of surgery, but then over time, as you're working on it and that inflammation is coming out, it'll shrink down and make the case very difficult. When we use OMIDRIA, which has ketorolac in it, intraoperatively, we can get away without using any topical NSAID or steroid in many cases. So for patients that don't have insurance, can't afford their drops, or you're worried about their compliance, we really like to use OMIDRIA in those cases to help with that post-op inflammation. One of the things I was worried about when I first heard about OMIDRIA was that the ketorolac is toxic to the surface of the eye. How would it do inside the eye? Would that be an issue for our patients? And that would cause some other maybe toxicity inside the eye, or even if it would leak out on the surface, maybe cause some problems, but it doesn't. So it's a totally different animal than a topical ketorolac drop. Once it's in the eye, it stays in the eye, soaks into the tissue, and does its job at shutting down inflammation inside the eye. We have some evidence that when we use OMIDRIA and we break the bag, we can measure the vitreous levels, and it's really high. It's about 800 times higher than it would be if you just did a topical drop. The tissue's gonna hold that ketorolac and then slowly release it over time. So it's probably in there even up to maybe a week. Using OMIDRIA has really helped cut down ocular surface disease, and it really has helped out with less drops overall and a better, happier outcome for our patients.